one of the main triggers for inflammation, or one of the things I think is the most common, is when there's disruption in the gut, in the GI tract, and the microbial balance in the GI tract. Because the GI tract is really where your body interacts with the outside world. And that's where you've got about 70% of your immune system. So if there's something wrong and there's inflammation in the GI tract, you've got all your white blood cells and all of your immune system set up right inside that initial mucosal layer to respond to any invading threats or toxins or anything that's being absorbed through that surface area. And once you've activated the immune system, you're releasing cytokines and inflammatory triggers, and that is circulating all over in your body. So it doesn't just stay in the GI tract.
Yeah. Yep. So let me just break it down for people who don't know. When you say cytokines, so when your body encounters something it doesn't like some insult, right? Some infection, some inflammation, and you're saying in the gut, it's going to release its own military forces, its own army with its own artillery, and they're going to start shooting rockets every which way, except you're in the line of fire.
Yep.
Right?
I mean, I tell people when it's food related, I tell people, like, once you have a food that gets from the GI tract into the bloodstream, and then you're, say there's a half digested protein from a cashew nut or from gluten or a dairy protein. Once your body makes an antibody against that foreign protein, then that antibody can go on to cross-react with your own tissues.